The subcommittee hearing is called to order. Today we have a hearing on helping families with needed care, Medicaid's critical role for Americans with disabilities. And I'll recognize myself initially for an opening statement. Let me begin by welcoming everyone back from our Christmas and New Year's break. Today we're meeting, this is actually our first hearing of the new year, and I realize how important this hearing is to so many people. It goes without saying that today's hearing is long overdue. I know there are many people who are in the audience today who have been calling for this hearing for many months and even years, and I want to thank you for all the hard work you do to advocate on behalf of the disabilities community. Today's hearing is about you and your families. It's about ensuring you have the services and support you need to remain independent members of society. Over the years, Medicaid has enabled millions of Americans with a wide range of disabilities to live independent lives by providing medical care as well as specialized support and services. But in spite of Medicaid's success over the past year, the Bush administration has launched an all-out attack on Medicaid, issuing a constant stream of regulations that seek to reduce the scope and breadth of the Medicaid program, thereby restricting its ability to provide for disabled Americans. These harmful regulations would, for example, restrict states' ability to provide rehabilitative services, including those designed to enable individuals with disabilities to improve their mental or physical capacities and remain out of an institution. Also eliminate the ability of schools to provide administrative services, such as enrollment, eligibility counseling, and referrals for Medicaid children. And most recently, restrict states' abilities to help manage the care and support services that are crucial to helping Medicaid beneficiaries live independently. The combined effect of these regulations, should they be implemented, would be a loss of billions of dollars for state Medicaid programs, thereby putting in jeopardy critical services that millions of Medicaid beneficiaries rely upon. Now, fortunately, in the recently passed CHIP extension, we were able to put a moratorium on the school-based administrative and transportation services rule, as well as the rehabilitation services regulation. But that was only a temporary measure to halt the administration's attack. If these rules and regulations are eventually implemented, they will have a disastrous impact on our safety net system's ability to provide services for disabled communities across the nation. And I'm looking forward to hearing from our witnesses today about exactly what the impact of these regulations would be should they go into effect. Today is not only about the administration's misguided policies. We also will be discussing a number of bills today that can have a positive impact on disabled Americans by strengthening Medicaid and offer alternatives to provide services for disabled Americans so they can remain in their communities. One proposal is legislation I introduced with Chairman Dingell and Senator Kennedy, the Community Living Assistance Services and Supports Act, or the CLASS Act. Currently, there are 10 million Americans in need of long-term services and support, and that number is expected to increase to nearly 15 million by 2020. Most private sector disability or long-term care insurance plans are constrained in the insurance protection they can offer at an affordable price, and neither supplemental security insurance nor old age survivors and disability insurance programs have any benefit differentials related to the extent and character of the disability. Because of this, Americans who have or develop severe functional impairments can only access coverage for vital services through Medicaid. These services, however, including housing modifications, assistive technologies, transportation, and personal assistance services, are critical to their independence. And this fact creates perverse incentives, forcing many to live in poverty and remain unemployed so that they can qualify for Medicaid. With Medicaid paying 50% of the cost, increased expenditures on long-term service are expected to add $44 billion annually to the cost of Medicaid over the next decade. And as America continues to age, we are faced with an impending crisis in long-term care. With the introduction of the CLASS Act last year, I aim to offer a new approach that builds upon our existing safety net system and helps our elderly and disabled finance the long-term care they need to remain active and productive members of their communities. This bill offers a new alternative path. It will create a national insurance program to help adults who have or develop functional impairments to remain independent and employed. And it also gives individuals added choice and access to supports without requiring them to become impoverished to qualify. I think the Class Act is an important step in the evolution of public policy because it's a framework based on the principles of independence, choice, and empowerment. We're also going to hear about the Community Choice Act, and I see a lot of the orange shirts that indicate so we know there's a lot of support for that. That, as you know, was introduced by Congressman Davis. It aims to redirect the focus of Medicaid services from institutions to home and community settings, giving eligible individuals equal access to community-based services as to institutional supports and enabling people to make their own choices about the care that they receive. And finally, I also wanted to recognize that Ms. Capps has an important bill that she's introduced, the Direct Support Professional Fairness and Security Act, which will provide enhanced federal Medicaid funding to those states that agree to match voluntary private direct support professional wages to the level of pay for comparable state employees. Now, as you know, this hearing is not specifically on any of the bill, even though these three bills obviously will be highlighted, and other ideas will certainly come up, and we certainly welcome them. And I again want to commend my colleagues for the work on these issues and all the bills that they have put forward, and thank the witnesses. And I would now recognize my colleague, the ranking member, Mr. Deal.